It's time for Quick on the Uptake here on AM 950 KTNF. Here's your host, Mike McEntee.
Hey, thank you, Marty. This little bit of advice, or this little bit of information, you probably know this already, but did you know that being poor can be hazardous to your health?
The religious communities in this state recognize that those who are poor are singled out in our sacred texts, but they're singled out for greater care, not for particular harm.
Yep, that's a reference today at the rally that nurses held to protest that Governor Pawlenty vetoed funds for the General Assistant Medical Care. And that means a lot of poor people are going to be without medical care, or possibly could be without medical care. The governor himself is going to hold a news conference tomorrow at 11 a.m. and talk about his plan for health care reform. We'll find out if it addresses anything to do with the funds that he has cut off for the poorest of the poor. But we'll be getting into that topic in just a little bit. I've invited on the program, or we've invited, the UpTake has invited, Eric Black, who writes over at MinnPost, to come on because he wrote an article today very much related to this about how actually your income, how much you make, can determine how long you live, or at least that's just part of the article. Eric, welcome to the program.
Hi, Mike. Thanks for having me on.
You read through a lot of the same statistics that I read through from this foundation, and you also combine it with some information that you got at a meeting that happened last week. Give us the basic gist of what your article's about.
Yeah, well, the meeting you referred to was a presentation by a woman who works with the Robert Wood Johnson Foundation Commission to Build a Healthier America. And they spent, it's a bunch of experts from with different perspectives on the health question. But I take it that their mission was to figure out ways to get to a healthier America, not necessarily, in fact, specifically not ways to reform the healthcare system. So the first thing they did was they tried to find out what kinds of socioeconomic variables indicate health problems. And I guess it's kind of obvious as soon as you ask yourself the question. Who's healthy and who's not healthy in our society has something to do with who has good health insurance, but it has probably even more to do with who's rich and who's poor, who's got a good education and who's struggling. Something to do with race, where you live, what your diet is, and a whole lot of things that are different and from the question of whether you've got a health insurance plan that gets you in to see a doctor when you're sick. We've been so focused in the last months on the question of what to do with the healthcare system, and I don't mean to disparage that at all, but as I was listening to that presentation, it was kind of like one of these no-duh moments when you realize that if you really wanted to elevate the overall healthiness of America, you might be able to do more good by trying to alleviate the effects of poverty than simply by changing the health insurance rules.
Now, one of the things I've heard argued against doing preventative care is there was some study a while back that said, well, if you do preventative care, long-term it just costs the same, mainly because people live longer, and that ends up costing us more in terms of health care. But that's not really the angle that we're taking here, correct? We're talking about how we can be healthier, not how we can reduce health care costs.
Well, as you know, the United States does spend more on health care than any other country by a huge margin, which is especially awkward considering that we don't have anywhere near the best results. So I wouldn't want to dismiss costs from the discussion. I think I'm struck by the fact that anybody who looks into it for 5 minutes discovers that most of the other developed countries have found a way to have better health outcomes while spending less money than the United States. And we ought to be trying to both improve our outcomes and cut our costs. The specific angle of my post this morning, which is that there are ways to improve the outcomes that don't really look that expensive, and that don't have to do with the kind of things we've been talking about in health insurance. It strikes me as possibly a double good. Of course, you're right. I often have the same thought you just did, which is that if you if you cure somebody's illness, you haven't reduced their cost to the system. They'll live longer, but eventually they're going to get sick, and the ultimate question of cost, I suppose, has to do with the total, how much health care costs they consume during their whole lifetime.
Of course, that doesn't take into account what they contribute to society by being alive. So that's, it's kind of a false savings here when you talk about it that way.
You're playing God if you think you can make the ultimate calculation.
There's another statistic that you had there that I was very interested in. It talks about the number of children that are in poverty. And it goes through the countries it lists 25 countries that are, I believe, industrial countries, and some of them you would expect to be on this list as being, pretty good. Like Denmark has a very low amount of child poverty, 2.4%. But when you get down to the bottom of the list, there's the United States, and it's a huge number compared to that. It is 21.7%. It's almost the worst one on there. The only one that's worst is Mexico. And you look at all these other countries in between, Hungary, Canada, Japan, France, all these countries that have managed to bring down the amount of poverty that's in their country. And you got to think that's directly tied to how much they end up spending on health care.
Well, I'm sure it is. The thing you said last, it strikes me that one of the reasons that they are able to get better results while spending less on health care than the United States is because they have less poverty. And if you buy into the basic premise of what I wrote this morning, which is, I think, what this Robert Wood Johnson study is about, if you have more poverty, you're going to have more bad health. You're going to have people dying younger. You're going to have a higher infant mortality rate. You're going to be you just have more people walking around sick. And so one of the best ways to improve health is to reduce poverty. And the United States, people ought to be kind of embarrassed to find that on a list of 25 countries, these countries are all in the OECD, the Organization for Economic Cooperation and Development. It's mostly industrialized countries. There's a number of countries that we know are a lot poorer than the United States. And only one of them, as you said, Mexico, has a higher percentage of its children living in poverty. On some level, people who pay attention know this is so. I suspect it wasn't really a surprise to you either, Mike. It wasn't a big surprise to me. But why are we not constantly asking ourselves, why do we have higher levels of poverty than so many countries that are not richer than us?
And the converse of that is that we have such a huge concentration of wealth in the upper 1% of America, and that wealth is just sitting there. It doesn't go down and do anything for the rest of the population.
I guess I'm not looking at data about who has more concentration of wealth. You and I both know that there is quite a bit of wealth concentrated at the top, although I'm sure there's quite a bit in most of these societies. And pretty soon we're talking about every issue under the sun, from taxes to spending. But certainly what we're looking at is about the other end of the spectrum. It's just a little hard for me to understand how people can avert their eyes from these kind of data. I know there are various ways that people explain it to themselves, because if they don't want to do anything about it. But I don't know. I knew all these things before I went to that meeting in some general way. But as I was sitting there looking at these data, I just said, we need to talk about this very directly and not try to avert our eyes or explain it away.
Now, this meeting you went to that was titled Beyond Healthcare, this commission that put this together came out with 10 recommendations towards a healthier America. And as you noted, they don't have much to do with doctors and hospitals, but they can certainly help the poor and focus on things that make them less healthy than the rest of us. What were some of those recommendations?
Well, I've got the page in front of me now. That's one of the striking things, because of how we're spending so much of our space in the public discourse now talking about ways to organize doctors and hospitals and classical healthcare assets. It was interesting to look at their recommendations because they were about things that simply will nudge people towards a healthier condition without necessarily getting them into a doctor's office. For example, the very first one is about trying to provide more developmental education for young children. Getting a good start in school and then staying in school and then getting at least a high school degree, if not more education, is one of the clearest indicators that you're not going to continue the cycle of poverty that you may have been born into. So they're talking about basically early childhood education. The second one is about the food stamp programs, WIC and SNAP, and several of their recommendations really got to issues of diet. I mean, how obvious is this, except that we haven't been talking about it much, that people who have healthy diets are going to be healthier than people that have unhealthy diets, and that there is quite likely a very big gap in the healthfulness of the diets across the class lines. They had another one down lower on the list about having only nutritious food lunches, school lunches, I mean. One place where they do have, where all the kids, rich and poor, are together is during the school year, during the school week, at lunchtime, and maybe at breakfast time too. There's an opportunity to get some healthy food into kids whose diets at home probably aren't very healthy. They've got recommendations about, again in the schools, trying to increase the level of physical activity that kids do. Obviously, obesity is one of the big contributors to unhealthy lives. I'm no expert on it. I gather it's a bit of an epidemic in the United States right now, and how obvious is it that diet and exercise are two of the keys to reducing obesity? And if there's anything you can do to work on our overall health problems by helping people, not get too overweight, it's probably money well spent. You were talking before about preventative stuff. Usually, lately, when we've talked about preventative stuff, we're talking about having people screened for colon cancer, which can be expensive procedures, and it's hard to know whether it pays for itself in terms of the money that you save by catching somebody's problem early versus the money that you spend checking people who actually turn out not to have a problem. But boy, money spent to cut down on smoking rates and obesity and other just basic fundamental things that are undermining people's health. I have a little trouble not believing that's not going to pay for itself.
Eric, we got to take a quick break here, but when we come back, I want to talk about one thing you mentioned, which was shopping, grocery shopping, and how that has an impact on things. So we're going to take a quick break. You're listening to Quick on the Uptake. We'll be back in just a few moments. I'm Mike McEntee.
Dark kitchens, dingy hallways, and poorly lit bathrooms are depressing. Let Solar Midwest brighten your day with a SolarTube skylight. Solar Midwest will install SolarTube's breakthrough technology in just a few hours to fill dark spaces with 100% pure natural light. Start saving money now. Turn off your lights and turn on...
Of course, I went through all of the trouble of making this little graphic over here, and I forgot to put it up until we were almost through the interview. So we'll keep interviewing so I can keep showing you. This is Eric Black up here, and that's him talking on the phone when we come back. And you're welcome to call in too. Of course, only if you're listening to this live. If you're listening to this on tape replay, too bad. You can't call in now.
Tasting and good for you from a local company offering healthy foods made right here in Minnesota. Kay's is committed to supporting the local economy and a healthy waistline. A single 1-ounce serving has the protein of 2 eggs, is high in fiber and protein, yet low in carbs, plus they're gluten-free. Kay's Naturals is both nutritious and delicious. Pick from honey almond, apple, cinnamon, or French vanilla. Visit kaysnaturals.com for a list of other healthy alternatives. You can find Kay's Naturals at Lake Winds in Chanhassen and Minnetonka, Fresh and Natural in Plymouth and Hudson, Valley Natural Foods in Burnsville, and Eastside Food Co-op in Minneapolis.
I don't want to bump his head here.
Meats.
For an easy, breezy Twin Cities stay, visit the new Aloft Minneapolis Hotel in the trendy Mill District of vibrant downtown. For travelers open to new possibilities, Aloft offers a modern, fresh, fun destination. With its loft-inspired design and free-flowing energy, Aloft is the ideal place for an AM 950 getaway. And AM 950 listeners get a special rate of just $89. Looking to mix and mingle? Clink your drink for happy hour at WXYZ Bar on the corner of 9th and Washington. Come see why everyone is abuzz about Aloft, the new twist in travel.
From the M950 Weather Center, here's our forecast now for the Twin Cities. Tonight, mostly cloudy with a low of 27. On Tuesday, partly sunny, Moore's high 39. Tuesday night, a 50% chance of snow with a low of 33. And Wednesday, a 30% chance of rain with a high of 43. Wednesday night, a 40% chance of rain and snow with a low of 36. And Thursday, a slight chance of rain and a high of 44. That's a weather check on AM 950 KTNF, the voice of Minnesota.
Here's a look at traffic brought to you by IHOP. No accidents to report right now on those Twin Cities area roadways. We are looking at some slowdowns, though. Heavy traffic on the eastbound side of 94 from about Dale Street to Mounds Boulevard. You're going to see some brake lights eastbound 494 from France Avenue to Portland, and 35E northbound a little sluggish from University Avenue to Highway 36. IHOP's gone totally NFL with the All-Pro lineup featuring AFC and NFC stuffed French toast. Served with all your favorites starting at $4.99. IHOP, come hungry, leave happy. That's the latest traffic.
22 minutes after 5 o'clock here on your drive home. Thanks for joining us. This is Quick on the Uptake on AM 950, the voice of Minnesota. Glad you could, glad you're paying attention to us instead of something else that could distract you on your drive home. We are talking with Eric Black, journalist at MinnPost, who wrote an article today called "Good Health May Have Less to Do with Our Health Care System Than You Think." And in it, he gets into the statistics about poverty and how that is connected with health care. And when we had to take a break here, we were talking about some of the things that don't cost a lot of money that can be done to make America healthier. And one of the things that you noted here was grocery stores. Tell us a little bit about that.
Yeah, it kind of jumped out at me because it was like a lot of these other things we've been discussing. Seems kind of obvious after someone calls your attention to it, but you're not normally thinking about improving the health of the country by a better distribution of grocery stores. But you know, when you're in a tough urban neighborhood, you're probably seeing more liquor stores and bars than you are full-service grocery stores. And if we're talking about people whose part of whose health problems derive from them having poor access to healthy food. Well, they had this statistic in the study. I don't know exactly how they're counting what, but they said that in the entire city of Detroit, 139 square miles of territory in that city, there were only 5 grocery stores. That just jumped out at me because it seemed kind of unbelievable. Detroit is a very big city. Maybe there's a whole lot of convenience stores, but this is probably part of the problem. You don't get the same access to really healthy diets if you're shopping in convenience stores. So one of their ideas is to look for ways. You know, we're not going to nationalize the grocery industry, and their recommendation goes like this: create public-private partnerships to open and sustain full-service grocery stores in communities without access to healthful foods. And they probably have a much more developed plan about it. And I'm sure there's lots of difficulties trying to figure out how you're going to create incentives for grocery store chains to open stores in places where they so far haven't wanted to. But again, it gets to something kind of basic, which is if you really want to improve the overall health statistics of the country, you have to get to some of the root causes. And bad diets even caused by people whose problem is that they don't have good access to healthier foods. Let's not kid ourselves. Plenty of people have bad diets because they prefer eating things that aren't good for them. That wouldn't be you and me, Mike. But certainly it's reasonable that to be concerned about the possibility that there are people trying to provide their families with healthy diets and just don't have access to the right food.
Yeah, nacho chips, not the best thing. An apple a day could keep the doctor away. The other thing in this was the whole discussion of race, and I think we did a show on this last week, and we started talking about the racial disparity. But when you break down these statistics, what you found is that race has a little to do with it, but most of this is based upon economic your status, where your job is, and that is so much based upon your education. And it just gets back to the very, very basics on things, that education can set you up for life, or it can cripple you for life.
As I was writing, I was thinking about people who are whose entry point into discussions like this is often through personal responsibility. They say, "I take care of my business, and I'm not asking for handouts." And there's always people asking me for handouts. And if they would take care of their business, they wouldn't need it. And I'm trying to be respectful of that way of looking at things. And I do think it's important for, especially as you become an adult, holding people accountable for the decisions they really make. I don't think you have to be a real socioeconomic expert to know that it's tougher for people who start out in tough circumstances to make the right choices than it is for people who start out in middle class or upper circumstances. I said in the piece, I do think America is a land of opportunity, and that if someone does things right in their coming up years, that even if they start out pretty low on the ladder, they got a pretty good chance of making it to the middle class. But some of these statistics, are about, for example, the infant mortality rate of kids whose mothers had a high school education versus those that didn't. And it's much higher for the kids whose mothers were dropouts. It's a little hard to hold that infant accountable for those circumstances. The definition of infant mortality is that you die before your first birthday.
Mm-hmm. You don't have a lot to say in that when you're that age.
Yeah, well, it would be great to encourage more personal responsibility, but the tough part of the analysis kind of breaks down when you're talking about something that is transcending the generations like this, and that's affecting kids when they're very young, and makes it harder for them to, get a good start.
It is sad that there are so many people who are actually unhealthy because of their economic status, or that they can't get out of that mess. And it just I get upset when I hear people saying, hey folks, you are underprivileged or whatever, but pull yourself up by your bootstraps. We need to do, I think, and again, this goes beyond just what you've written in the article, but we need to do something as a society to make sure that we give people boots, at least, to pull the bootstraps up. And sometimes I get the feeling that we've even given away that these days. The safety nets have gotten so thin.
Before the break, we were talking about those data comparing the poverty, the actual rates of children in poverty across country lines. Mm-hmm. That's probably a very complicated conversation, which I haven't focused on, but there must be a lot of explanations for how that disparity is so large, and why the United States ends up basically the only rich country that has such a large underclass. And maybe, I'm sure there's a lot of different explanatory factors. But it's pretty clear, and this post I wrote this morning, this study that the Robert Wood Johnson Foundation did, is a pretty clear indication of a lot of other problems that we think of as our societal problems get a lot easier if you deal with the poverty piece of it.
That is great. I think that's great advice for anybody who's focusing on the problems that we have to solve here over the next. We've got a lot of problems to solve here over the next few years, but that's one of them. Eric, I want to thank you for coming on the program. We have to run off here now, but I appreciate you filling us in. And again, Eric Black is a reporter, is a journalist that you can find excellent reporting over at minpost.com. And Eric, thanks for joining us on the show today.
Keep up.
All right. We will chat with you later. Okay, we're going to take a break, and when we come back, we're going to be talking about Governor Tim Pawlenty and the General Assistance medical care and all sorts of other things that are fallouts because of that. You're listening to Quick on the Uptake. We'll be back in just a few minutes.
Are you ready to take the next step?
Okay. I have a blank slate pretty much in front of me here for the rest of the show. So I've written down some thoughts. You're going to have to listen to me for a while, just talking about whatever I feel like, unless you want to call in. And as you know, the number 952-946-6205. I'm going to see also if I can get some stuff here queued up. And I may try doing some quick editing here, too. Oh, the phone is ringing. We'll see. Maybe it's one of you folks calling. I can't answer it, but the engineer is about to. Okay, let's see. Looking for this. You're going to hear some noise in the background while I do some editing. So.
Tipper Gore, who's in the house. You do every day. I've made it. Administration will continue fighting to achieve them. Time in which we put a stop to discrimination against gays and lesbians, whether it we will reach as we wrestle with these enormous problems. And while progress may be taking longer, about you're also parents worried about a basis. Repeat it again. It's not for me to tell you to be patient. Now, I've said this before, I'll repeat it again. It's not for me to. I also appreciate that many of you don't believe progress is coming. I want to tell you about it. I also.
Yeah, it's me editing. I'll be done in a minute. Okay. I know, this is exciting. Okay, let's see if we can get this in here. All right. Well, Grace has called in, so we'll check in with her coming up.
Of a blaze that left major damage to a home near the University of Minnesota. According to the Minnesota Daily, an unextinguished hookah coal may have been the source of the blaze. 2 missing teens from Winona have turned up safe in New Orleans. Few details have been released other than the 2 teenagers were picked up by police after trying to check into a Louisiana hotel. Toyota owners through October visit your participating Toyota dealer for great tire specials.
We have some information here about what we're going to talk about with Kelly.
Toyota's quality saves you money. With AM 950 KTNF News, I'm Nicole Wilson. Here's the latest look at traffic brought to you by Toyota Parts and Service. Still got this stalled vehicle crosstown eastbound ramp to North Highway 100. Watch for some delays there. Also looking at a crash southbound Highway 10 at County Road 96 in Arden Hills. And another stalled vehicle 94 westbound after Western Avenue off onto that right shoulder. You're going to see delays northbound 494 from Highway 55 to Bass Lake Road. Toyota owners through October visit your participating Toyota dealer for great tire specials this fall. Buy 3 tires and get the 4th one for just $1. Toyota's quality saves you money.
Welcome back to a snowy Monday. That was a nice surprise this morning, wasn't it? Waking up and seeing that it was suddenly December, or it sure looked like it for a little while. It's going to go away, and it will eventually get nice out by March. I hope before then. It's normally, 60 degrees this time of year? Ow, this is not what I expect. Wanted to turn to something you may have been hearing about in St. Paul. If you are a fan of a show called Extreme Makeover Home Edition on ABC, you probably know that they've been in town taping something in St. Paul. And this is where they basically remake somebody's house. In fact, they almost demolish the place. In fact, they may in this particular case demolish the house and rebuild it. But is that doesn't that cost us in something? Aren't there hidden costs when something like that happens, and who picks them up? Grace Kelly, who blogs at Minnesota Progressive Project and also does some volunteering for the UpTake, is on the line. And Kelly, you've been following this story. What have you been finding out? Hello, Kelly. Here, let's see if we can...
Please.
There. Okay, now I've got you.
Now I've got you. Oh, you've got me on?
Go ahead.
I was there about 3 days, and it was interesting because the volunteers were so excited to be there. And I was mostly focusing on interviewing the volunteers. And people would just love the show and would come out and do any kind of muck at all, including standing in the rain and putting up, like wallboard and really quite mucky tasks. So it was quite impressive. When I talked to the builder, he said that in 3 days they had filled out every volunteer position they had, and even still, people would still come out not even having found out and just wait for the opportunity to do something. I mean, that's kind of incredible on one hand. Now, the other contrast to all of this is I'm standing out there and I'm watching all of this go on, and it's all for one house, for one rebuild. And as you know, I was covering Rosemary's house when it was being foreclosed. And it could have been saved for far less money. If you would have taken everything that had been spent in this house, we probably could have saved 50 people's houses from being foreclosed. And yes, they wouldn't have been gorgeous remakes, but people would be living in their own homes and still having that comfort of being there in their own home. And so the contrast was just incredible, especially today because I did a lit drop. And as I was walking between houses, it became astoundingly clear, once you get close, how many houses are actually empty. So when you go through our city at night, when there should be lights on, there must be incredible numbers of just dark houses, one after another, and it's kind of like our city slowly dying.
So a lot of volunteer effort goes into making sure that this house gets remodeled. And that's really good. I mean, it's like a commercial version sort of Habitat for Humanity. But where's the money come from to actually renovate the house? The volunteer labor obviously does some things, but the money to rebuild the house, where does that come from?
Well, I'm not certain that this is correct. Somebody told me, so this is on the level of rumor,
okay,
that the show does finance the money. And at one point I think they don't even have the people pay it back right now. So I think it's part of the show costs, and any show has a rather big expense, and this one actually goes towards doing something rather expensive rather than just building sets. So think of this as a giant, beautiful set, and then you get the idea of where the money comes from. But I'm not exactly certain. I know that a lot of the effort is volunteered, and basically a lot of companies volunteer their efforts just on the hopes that their truck or their sign will get some advertising.
Now, does the City of St. Paul or Ramsey County donate anything to make this happen?
Well, the City of St. Paul was under contract to provide a number of police, and the show itself has its own extreme security that literally has extreme on there, and they have a huge security staff. And then if something actually goes wrong, the St. Paul police officer actually does the arrest and processes the paperwork. But the interesting thing is Ramsey County provided a significant number of volunteers on each day. I mean, there were like 14 to 15 on some days that I saw, and some days there were less. And they also provided food, and they also provided an extra service. But I don't know where the money for all that is coming from. That's still a mystery. We're not certain.
You mean, so we're not sure if these were actual volunteers or if they were being paid by Ramsey County to come out there?
Well, I'm certain that some were volunteers, but one guy described himself as a quasi-volunteer, and he had a discussion with another gentleman that I overheard where he said that, what time do you get off? And he said, well, I started work today at 7, so I get off at 3:30, so it sounded like very much they were on the clock. However, I haven't been able to verify that.
Well, that's interesting. I mean, there's nothing wrong in the sense that if we're doing charity work or investing in our city that we have police assisting with doing this, but this is pretty much a commercial venture, and it is one house as opposed to doing something that's going to help the greater good of everybody.
Yeah, it's interesting. So I'll let you know. I don't know how I'm going to find that information. If anybody's got any suggestions, they could type it into the blog or call it in to us, because I'd like to know how to figure out if we can figure out who was paying what. But some were definitely volunteers, but I'm not sure that all of them were.
Okay. Well, Kelly, you're going to stay on that story, and when we get some more information about it, you'll join us again and update us. And, of course, people, you can commit an act of citizen journalism by helping us out and looking for some of that information that Kelly is looking for. And if you are able to get it to us, either come on our live blog at theuptake.org, or you're welcome to send us an email at info@theuptake.org, and we'll make sure that Kelly gets that information. Anything else you got working here, Kelly?
No, I'm out there, out in the streets, putting lit out, because this year is an election year for the city of St. Paul and for the city of Minneapolis. So right now, in the middle of the snow, there are people hitting the streets and leaving literature at doors. Can you imagine?
That is now,
beautiful.
The election is November, correct? Beginning of November.
Yes, in just a few weeks. In Ramsey County, we'll be electing our mayor and our school board. And in Minneapolis, I think just about everybody is up for election, which is quite a huge slate, because not only do they have a mayor and city and school board and city board, but they also have park boards and taxation boards and all kinds of interesting things.
Well, we'll keep on top of that, and I'm glad that you're watching it for us and be able to pass that stuff along.
All right. Thank you very much.
Okay. That is Grace Kelly, who again blogs over at mnprogressiveproject.org and also contributes video to the uptake.org. If you're interested in being a citizen journalist, you too can get involved. I mentioned you can send us an email at info@theuptake.org, but let me also mention that you can simply just look at our calendar of some of the interesting things coming up and volunteer to cover them. And again, just drop us an email. We want to cover what you're interested in. We want to cover what you're passionate about, because right now all you get is what the corporate media thinks is important. And you know what? There's a lot more of important stuff happening out there than just what happens to be on the assignment editor's desk at WCCO-TV or the Star Tribune or the Pioneer Press or whatever it may be. A lot of things get ignored because, well, they think it's really not that interesting. And as you know, there's a lot of things out there that are important that do need to be reported. Some opportunities here for you coming up tomorrow, and actually this is a big one. Tomorrow, Tuesday, the Senate Finance Committee, this is in Congress, is going to vote on the health care bill. Now, you may say, well, Mike, that's in Washington, D.C. What can I do? Well, we're going to be monitoring this and carrying it live on the uptake.org. You are welcome to watch and help us live blog, help us find the interesting bits of information that really need to be repeated to the rest of the world. That starts at 9 o'clock tomorrow. Other things going on. There is Governor Pawlenty. I mentioned this at the top of the hour, or the top of the show. Governor Pawlenty, tomorrow, 11 o'clock, is having a news conference at the state capitol, and he will be talking about his version of health care reform, some health care initiatives that he wants to get out there. Of course, this was right after he was visited by the nurses today, who were complaining about his vetoing support or vetoing money for the General Assistance Medical Care Fund, or GAMC as it's known, causing the poorest of the poor to be without health insurance and health care. But the governor's holding a news conference. He'll be bringing in his Human Services Commissioner, Cal Ludeman, and Commerce Commissioner, Glenn Wilson, to talk about this. And we are rounding up a merry band of citizen journalists to go down there and cover that. And if you're interested, again, you're welcome to drop us a line. Also, here's another event this week. This is on, I believe, is it tomorrow? Yes, it's tomorrow as well. Dan Rather is in town. He's going to be speaking at a Planned Parenthood event. And we're interested to hear what he has to say, and would be glad to help you get in. We just need somebody who's interested in running a camera and going on down there. So those are all things. Oh yeah, one more. Since we're talking about famous journalists, Cokie Roberts is going to be in town. She's going to be in town on Wednesday, and she'll be it's part of a whole forum that's. We're going to have not just DFL, but also Republican governor candidates there, and they'll be talking about policy and about hunger. And Cokie Roberts is going to be moderating all this, and she is also going to be handing out the second annual Voice of Hunger Award. But if you're interested in helping us cover that, again, just drop us a line at info@theuptake.org. All sorts of opportunities like that. And if you have something that you're interested in, something that you're passionate about, I know Craig Stelmacher, who is one of the folks who's just recently started helping us out, is out covering the Minnesota 350, which has everything to do with biking and climate change. And then some program later this week, we'll be talking to him about that. But he'll have some interesting videos to put up at theuptake.org. So those are many ways that you can get involved here at the Uptake. We certainly invite you to do so. And also, you can always send us a contribution. Go to theuptake.org. If you don't have the time or the means or the information and the skills necessary to do citizen journalism, you're always welcome to donate to us. We're going to take a break, and when we come back, I am going to play you some of that stuff from the nurses' rally at the state capitol today, and find out why they are so angry with Governor Tim Pawlenty. This is Quick on the Uptake. We'll be back in just a few minutes.
Are we bringing back the Al Gore lockbox?
No. I wouldn't even discuss Al Gore. I mean, his inner circle is square, right? Let's face it.
That's funny. He made a joke. He's a funny conservative.
Tim Geithner is kind of square. Yeah.
His head is actually square.
Yeah, it is.
He looks like Gumby. Okay.
He was once a little green ball of cash.
The Stephanie Miller Show, weekday mornings from 8 to 11 on AM 950 KTNF.
Warner Stellian customers know the difference between a low price and the best bottom line cost. That's what we've been delivering for over 50 years. Warner Stellian guarantees the lowest price on over 40 brands. And Warner Stellian customers enjoy free delivery, professional installation, and free recycling of replaced appliances. Our competitors try to match our pricing because they know they'll never match our service. Make Warner Stellian your appliance specialist. Go to warnerstellian.com to find the location nearest you.
Why do I need a whole closet full of chemicals just to clean the house?
I know. I'll just mix them into one bottle.
Oh, that was brilliant.
There's gotta be an easier way.
Now you can clean and disinfect everything with just one versatile product, Vital Oxide. Vital Oxide is a hospital-grade disinfectant strong enough to kill 99.9% of bacteria and H1N1. And Vital Oxide sanitizes almost any surface, including carpet. Yet Vital Oxide is a green cleaner and is 100% biodegradable. Safe enough to use on cooking surfaces and children's toys. Use it to remove mold, mildew, and unpleasant odors. And with our convenient travel size bottle, you can instantly disinfect door handles and public restroom seats. You can find Vital Oxide at Aero Ace Shakopee, Hardware Hanks, True Value. Do it best at Ace Hardware. And if you suffer from allergies, try our other products like Anti-Allergen Solution or our Dust Mite and Flea Control.
Trust the plumbing of your home or business to qualified professionals. Call the boys at Artisan Plumbing. Locally owned and operated. From leaky faucets to whole house renovations and commercial build-outs. Artisan Plumbing employs master plumbers, skilled craftsmen, or as the name says, plumbing artisans. Licensed, bonded, and insured. Call Artisan Plumbing today at 952-232-6392. That's 952-232-6392. Artisan Plumbing and Remodeling, where quality is not a pipe dream. Call 952-232-6392.
Here's a look at traffic brought to you by IHOP. No accidents to report right now on those Twin Cities area roadways. We are looking at some slowdowns, though. Heavy traffic on the eastbound side of 94 from about Dale Street to Mounds Boulevard. You're going to see some brake lights eastbound 494 from France Avenue to Portland, and 35E northbound a little sluggish from University Avenue to Highway 36. IHOP's gone totally NFL with the All-Pro lineup featuring AFC and NFC stuffed French toast. Served with all your favorites starting at $4.99. IHOP, come hungry, leave happy. That's the latest traffic.
Hey, 10 minutes in front of 6 o'clock. Coming up at 6:05, it's Minnesota Matters. Stay tuned. That's after the news at 6 o'clock here. A slight correction to something I said earlier. We were talking about the events that the UpTake is trying to get people to cover this week. We mentioned the Dan Rather Planned Parenthood event. Apparently that is not open to cameras, strangely enough. One of the most prominent on-camera people of recent note, journalist, does not want to be on camera, so we won't be there. We're talking, though, about Governor Pawlenty, who hasn't been here a lot either the last several months. He has been traveling around the country, and one of the things that he has not been talking about much in Minnesota is health care. That's going to change tomorrow. He's holding a news conference about it. Not sure if it's in response to an event that happened today. The Minnesota Nurses Association descended upon the state capitol. And here's a little bit about what happened.
Today we are here to demonstrate our opposition to Governor Pawlenty's outrageous, unethical veto of general assistance medical care. Nurses are on the march, gentlemen. All right.
Now, I'm going to play you something here from a man who was on general assistance medical care. He has an interesting story, and it's interesting about what he says about general assistance medical care, how he would have not survived if he didn't have it.
I was a successful business owner up in Duluth, and I moved down to here. I had a major health crisis, and there was some serious crisis with my business. We ended up losing the house, and we ended up losing the businesses, and we were actually a victim of a equity scam. We lost $130,000 in our equity, and we found out. We walked into the office fully expecting to get a check so we could get an apartment and move in and Well, that wasn't forthcoming. We went into the office. They had roses on all the desks. They were drinking Dom Perignon, and they were saying, see ya. We snapped psychologically. I just gave up. After what happened with the business and how ruthless people can be sometimes, my wife and I both just gave up. And what happened is I floundered for about 3 years, and finally I got a place to stay, a place to live. I could actually have a base in which I could, clean, take a shower. To live a human life again. And at that point, I started into dealing with my health issues, and I've rebounded. I just started a new business. I'm on my feet again, and this would have never happened without GAMC.
Now that was Robert Fisher. Robert Fisher, who is a former GAMC recipient. The next person we're going to hear from is Stephanie Wells. We've actually talked to her on the program before. She's a registered nurse at Hennepin County Medical Center, and she was at the rally today.
I am concerned about the hospital that I work in. HCMC really provides, it's a safety net hospital. And we probably get more GAMC patients than a lot of other institutions. It would be devastating to us to have that money gone.
And, it's not just the hospitals that are concerned. It's also the religious community. There's a coalition that is made up of Protestant, Catholic, Jewish, and Muslim communities in Minnesota. And their spokesperson today was Douglas Mitchell, who is the associate pastor at Westminster Presbyterian Church in Minneapolis.
The religious communities in this state recognize that those who are poor are singled out in our sacred texts, but they're singled out for greater care, not for particular harm. So to balance the budget on the backs of those who are the most vulnerable and have the most need for care simply flies in the face of what the justice that's called for by the Protestant, Catholic, Jewish, and Muslim communities that are represented by the Joint Religious Legislative Coalition.
So, Governor Pawlenty, the folks who are church-going, the folks who are the ones who say, let's take care of the poor, let's take care of those who cannot fend for themselves, they're saying, shame on you. Shame on you for cutting health care, for cutting the money for the poorest of the poor in Minnesota. Now, as I said, the governor is going to be holding a news conference tomorrow at 11 o'clock. He will not be able to restore the money to GAMC. That is not within his power, since he has already pulled it out. It's a line item veto. However, as much as I really doubt it, I still hope that maybe he's going to address that problem tomorrow. To address the problem that it's not just the people who are poor who are going to be losing general assistance medical care. It's not just those people who are going to be hurt. It is going to be you. And here's the reason why. And it's a little bit counterintuitive, but once you listen to the explanation, you'll understand. Hospitals across Minnesota that take GAMC patients use that money for not only GAMC, but they also use it to provide you health care. And we have some of the best world-class health care in Minnesota because some of those dollars are being spent there. Now, what will happen here without GAMC, and we're under 140 days until GAMC goes away, what will happen is not only will there be fewer dollars going to these hospitals, but they're still going to end up providing that safety net of health care for people, that health care for folks who end up in the emergency room because that's their primary health care now. That's going to cost even a lot more than GAMC cost would have been, a lot more than what the state would have paid. So you're going to see them suffering deficits. And you're going to see that your health care, perhaps maybe the HCMC, which we heard from her, we heard from a representative from HCMC here earlier in the show, perhaps even HCMC may end up having to cut back its world-class triage unit that is responsible for saving so many lives. That could be one of the casualties here because our governor decided that he was going to be Mr. Macho and take care of the budget deficit by just saying no and pushing it off onto somebody else's shoulders. Well, Governor, good luck with that run for president, because this is going to hound you during that entire run. If you decide to run for president, and it's perfectly up to you, here in Minnesota, we're going to keep reminding you of the legacy you're leaving behind in this state. Not just health care that's being cut for the poor, but for all of the things and infrastructure that is suffering here terribly. That's it for today's Quick on the UpTake show. I'm Mike McEntee. This is a production of the UpTake.org. You're welcome to check us out there. And join us again tomorrow for our show, which is here from 5 o'clock to 5:30 on Tuesday. We'll see you then. And Mom, thanks for watching and listening.